The people have spoken and nobody wants to talk to me anymore. They all want to ask my husband, who's an OBGYN, some questions. So let's go surprise my husband and find out if he is willing to answer questions from the viewers. My love, the people have spoken and nobody wants to talk to me anymore. They've all decided that they want to interview you. It's you that they want to see.
They've spoken?
Yes, they've said.
I haven't heard anything.
Well, I'm going to tell you what they've said. They said that they want to ask an OBGYN questions anonymously. That this is something that women, maybe some men, there's some men questions in there.
Can I get the granola out of my teeth before we film?
Sure. But they want to be able to ask a question to the doctor that handles the most sensitive of areas, literally. A question anonymously without them having to be the one to ask it. And what better way than to utilize me who has no filter. Filterless. So, are you up for this challenge? Like, will you do it for the people?
Sure.
All right, cool. Let's do it.
All right.
Okay, here's a good one. There are many smells. Has anyone ever thrown you off or caused you to make an audible gasp? Y'all are asking him tough stuff that's hard for him to really answer here.
But what they don't understand is, so if you're talking about a discharge situation, the only time that it's going to be really bad is if you have a fistula, so which is like a connection between the rectum and the vagina. Right? So you're going to have stool in your vagina, right? So obviously that is not going to smell. Right.
What about like really fishy?
There's nothing that's that bad. It's not in comparison to like somebody has a draining abscess or something like that. That is the stuff that really just
gets off. To you.
That is.
I will say that your sniffer is not the best.
No. See, I was made for this job.
Yeah. So luckily, Does he have any nicknames in mind for different vulva looks, arrangements? What do you call it?
How do you rearrange your vulva?
Well, I think they probably mean like a fluffy mound versus a skinny mound versus...
Oh.
I don't think you've gotten that creative, have you? Like a fupa chalupa?
Yeah, I've never noticed like different... like pear or apple shape. I've never.
Some just have more padding than others.
Yeah, exactly. Some are just have more adipose tissue, right? That's how I'm supposed to say it.
If I don't wash this is so good. If I don't wash my hands before changing a tampon, could I get coronavirus? That is good.
No, the coronavirus doesn't come from the vagina.
Oh, good. Okay, this is cute. During an exam, which is more common? Bare feet, socks, shoes, and what do you prefer? There's no shoes usually. Have you ever had women wear shoes? Like high heels? During a pelvic exam?
I remember we had to do these...
You're already laughing.
We had to do these pelvic exams in med school on these people that would volunteer,
Oh, okay. That's nice.
Oh, yeah. It's
nice of them.
But, most of them were very granola-y types, And I just remember the first time this lady, she comes in there with these Birkenstocks on, and they were so dirty. Like, it was like she walked through the dirt to get to the exam. Her shoes smell so bad. So if your shoes smell bad, then...
She kept the Birkenstocks on?
Oh, yeah.
Ew, that's nasty. Do most women present bald or au naturel?
I think it would depend on the age group, but I think most people nowadays are shaving.
What about landing strip? They didn't even leave that in. It's either bald or...
I mean, how many combinations is she going to list?
Yeah, that's true. I think, being an L&D nurse, I think more often than not, they're not all natural anymore. That's what I would say. I mean, I don't know. Does he ever want to punch a father after hearing the nasty request, can you put an extra stitch in, Doc?
I don't, for the most part, the women nowadays handle that very well themselves. They'll
and I think that you've heard it so many times that it's like, you gotta just let it roll off or you'd be mad.
People rarely say it nowadays because it has become so overused.
Why a full conversation during the GYN exam? I'm in no mood or position to talk. Why do you do that? Well, maybe not you, but why do they do that? Like, let's say you come in for your annual and they're like, so, you doing any vacationing this summer? Like, as the speculum's going in, like, why does this happen?
That was just stupid.
Do you routinely talk to them while you're doing it, or no?
No, I think for the most part, people feel the need to, all right, you have like a 10-minute window that you're going to be in this room.
Right.
You got to find some time to sort of like have an actual rapport with the patient so you can get the patient to like you. And so...
But you still need to get in and out and get to the
So you've got to ask all like the clinical questions. I mean, you can't be like, doing your pap smear and be like, so... Any surgeries this year? Any medical problems? You gotta get that stuff out of the way first.
What is your favorite part of your job and your least favorite part of your job? It's not like we're at a job interview.
My least favorite part,
being away from me.
Yeah, would be the hours / pay issue. My favorite part. I mean, it's
bringing babies into the world.
Yeah, it's nice to know that you're able to help people out when they're sick, and
I think that's cute. Who designs the damn exam gowns? I could have brought my own dinner napkin for my shoulders.
Yeah, those are kind of worthless.
They're ugly.
Those paper ones.
They're horrible.
Yeah.
They're crunchy. You never know which way to put it on right.
Yeah.
I mean, I think it's just all cost effectiveness. Probably like the doctor's offices.
I mean, why not just say, hey, if you're coming for your annual, just wear a skirt.
Yeah, wear a skirt and a button top.
Yeah, little blouse.
No bra.
Buttons. Yeah,
that's all you need. Save money.
Oh, so you're going to the OB office today, huh?
Has the speculum ever just fallen out of somebody and fallen out of your hands? Really?
Yeah. Well, I mean, normally it's like where they'll like cough or something, and it's like,
It just goes flying?
Yeah. I mean, it happens.
If it's stanky, do you discuss personal hygiene? Stanky. I like that question. If it's stanky.
I must say that I don't unless they ask me. Like, if they're saying that they're bothered by it and they would like advice,
then you will?
Then I would, But,
do you ever just smell it and you're like, we need another swab? Like you need to culture something?
Yes.
Okay.
Yeah.
All right. Well, at least that's good. Here's another guy question. Where exactly is that G-spot? I'm just asking for a friend. He's asking for a friend.
For a friend.
But I think
the guy who doesn't know where the G-spot is?
You don't have to answer this, and I can edit this out, but I think that people are really interested in where this is located. So
the thing, like,
if you had to...
From a medical standpoint, there's no such thing.
Okay, from a non-medical standpoint...
Apparently there's a thing.
Where would you aim?
That's for me to know and them to figure out.
I'll talk to y'all later.
I'm not going to tell other guys our secrets.
Okay. Is it common for women that deliver to want to take their placenta home with them to eat or encapsulate? Is this a growing trend or just overemphasized by certain celebrities?
I would not say it's common in any way, shape, or form. I would say maybe 5% of the time people will want to do this, but I'm very much against it. The whole thing that they always say is, well, dogs eat their placentas,
Yeah, they do.
But dogs lick their own butts. So I don't think that we should start licking our own butts either. Like
butts. I like you said, lick your own butts.
I mean, we're not in a third world country. It's not like we're dying for protein in America. You know what I mean?
Oh my God, these people are funny. if I decorate my girly bits like with sparkles, can you?
Who did that? The Jennifer Love Hewitt, the rhinestones or whatever.
Yeah.
That just always struck me as something that would be uncomfortable. Like,
do you ever see sparkles or like little decor or anything?
never.
Piercings?
I mean,
Piercings,
somebody
yes.
might have thrown some glitter on there, but I wouldn't even pay attention to it. You know what I mean?
Just
but
made me spit.
I would be like, oh, that's her body lotion or whatever the hell. But yeah, if you're putting like that, like stick-on rhinestones, like, I mean, obviously you're trying to draw attention to the area, but then when you go to start having sex, like, that's gonna hurt. You know, like.
Yeah, that doesn't feel good. Do you always make sure to have somebody present? And has anybody ever said anything, like accused you of something?
Not that I know of. You know, a lot of times when something like that happens, like somebody accuses someone, it's going to go through like the hospital administration and be investigated.
Right.
And you might only be notified if you're being brought in or something for questioning about it.
But luckily, that's never.
No, I mean, all of us. Well, I would say. Every male OBGYN that I know would never do an exam without someone in the room.
What drives him most crazy when watching births on TV or in the movies?
Some of the things that I think the biggest thing that bothers me is everyone that you see on TV is this like drama-filled screening event, right? Like just.
Right, like they don't have an epidural and they're.
Yeah. And how do I say this? It seems to be giving some women like just free reign. Like they feel like they can just act however they want.
Oh,
say
yeah,
whatever
right.
they want and act as crazy and yell. And it's like.
Because that's what the movies make it look like. That's what the movies
make it out to be. And it doesn't have to be like that. I mean, there are many... You can tell, like, when you have, a lot of patients that come from outside the United States that probably don't watch these movies all day long.
Right.
They'll come in there without an epidural and barely make a sound, and it's...
Right.
It's amazing.
And then you have others that are, like, kicking and screaming and trying...
thrashing all over the place and, acting a fool and...
But I agree with you about that. Like, it seems like on the TV shows, like, they never just show a well-controlled, like,
no.
She has her epidural, she's happy, like, they're giggling, and a lot of times...
you never see anybody laugh it out.
No.
Just giggle and it comes out.
Do you ever notice if somebody's legs are shaved or not?
Yeah, you notice. I mean, especially if
But you're not
dark
looking
hair.
for it.
And, no, I'm not like, I wonder if this one's going to have shaved legs or not. I mean, sometimes you kind of suspect.
But it's true. If they have like dark, like black hair, like Hispanic hair, it stands out more than like.
It certainly does, but it's not gonna. It's not gonna affect me in any way, shape, or form for the 30 seconds that I'm down there.
Was there any vaginal exam situation encountered during your day that killed the sex mood home that night? Something just too difficult to compartmentalize, and was Jessica frustrated? That has never happened. Never happened. I don't know. He is able to disassociate that. Do all women hide their underwear under their clothes that they just removed?
Oh, like fold it. And...
Yeah. Like when you go to the room, is there ever just the panties are just laying out?
I would say all normal women would do that. If you're like displaying your Victoria's Secret thong on top of your pants. That's a sign that that's where you might need 2 chaperones in the room.
Do you think looking at a butterfly sticker on the wall or something would make it better for the patient getting a pap smear? I had a doctor one time that had a poster of like men, like sexy men up there on the wall.
Really?
Yes.
That's clever.
That was years ago when I was 16, 17 and first went to the GYN, but yeah.
Where did your mother take you?
Oh God, has anyone ever taken a poop during an exam?
Not anyone that's coming to the office. Like there's times that we have to do exams on people that are in the hospital, you know what I mean?
And they're numb too, and they don't know.
Even sometimes if they're not numb, if you're really, have a lot of medical problems and you're on like lactulose or something, you know what I mean? There's times that things like that happen, yes.
Is wearing underwear good for the vag or not? Would it be better for women to not wear underwear?
I think if it's cotton, you know, then it's fine, you know. But there is a case to be made that like all these like satin and non-breathable materials are going to be making it a little bit more difficult.
Can fester the moisture, right? All right, so one lady would like to know, do most women's pubic hairs thin out a lot after age 50? Yes. Kind of like your hair on your head or anything because your hormones change?
Yeah, I mean, it's not like, you know, you look at it and, oh, look, she's got vaginal alopecia. But
have you ever been in the room where a baby came out and the father realized it's definitely not his?
yeah. There's usually not as much ruckus as I would expect, I guess, you know? Like most of the time they just leave. You know?
Really?
That's what's happened most of the I mean, I think in some ways, if that's happening to you,
you already suspected it.
Yeah, you've probably not been in a stable relationship, you know.
You've never seen like any Jerry Springer things go down. Something.
No.
Okay, all right. I think that's what they were kind of getting at.
Most of the Jerry Springer stuff goes on, you know, when there's a guy that has 2 women pregnant at the same time and the women are fighting.
Wow. I want to know why in the world would a man want to be an OBGYN? I would hate my husband having that job.
Sounds like she doesn't trust her husband.
Why in the world did you want to be an OBGYN? They all want to know.
They all want to know.
Yeah, they're dying. What is it? What is it?
I mean, I wanted to do surgery first, but the surgeons just seemed so pissed off all the time. They were all like on their 3rd wife and
Angry and throwing instruments
the
and stuff.
OBs were just making like stupid sex jokes in that OR all day long, and I was like, yeah, this seems fun.
There you have it. That sounds like it's an honest answer. Do you remove extra adipose during a C-section?
No.
Damn, people are going to be mad about that one. I have had patients ask that all the time. Yeah. I once had a labor patient whose husband YouTubed how to check his wife's cervix and informed me she was 50% effaced and 4 dilated. I had no words. What words of advice would you give your patients to do it yourself? Or have you had people that have checked their own wife or something?
Yeah.
Were they right?
No, I mean, but
No.
yeah, YouTube it up, guys. Have at it.
All right, this is the last question. Do women know their own body parts? One of my patients pointed to her clitoris and said, "Is this where I pee from?"
Yes, a large amount of people don't know their own body parts. That's for sure.
Yeah, they don't. All right, I think we're gonna call it a wrap on here. We're done.